Okay, now we are going to move on to the investigations. Okay, now when speaking about the investigation, we need to point out the fact that what in speaking about the investigation, we're going to use the SchrDbb algorithm to visualize the investigation. Is it clear? So when you put your diagnosis, as I've just said on the last tutorial, you put the investigation start by the goals of investigation. Your goals of investigation, you need to investigate for your disease and you roll out your differentials. You investigate for the disease, you roll out differential diagnosis. Is it clear? The second goal of investigation is that you investigate for the cause. Is it clear? You investigate for the cause. The third goal is going to be investigate for the complication. Investigate for the complication. The fourth goal is investigating the background. You investigate for the background, and the fifth goal is for the follow-up. So those are the different elements that you have to put up in your investigation. Now I've already said that in the according to SchrDbb, when you investigate for the diagnosis, you need to know that what you use the principle of investigation, and the principle of investigation is to support, then you confirm. Is it clear? And why for the other one you use now the means of investigation, which are laboratory, then you have imaging means of investigation. Now we start now with the first investigation, investigating the disease. In this case, the disease is hyperglycemic crisis, and your hyperglycemic crisis can either be diabetic. Your disease here is mostly the complication of the diabetes. I'm not going to speak about the other complications because they are mostly seen in other systems. Ischemic heart disease is going to be seen in another system. Retinopathy is going to be seen in another system. So the major complications which are associated with diabetes are the acute complications. So if you have a patient that has hypoglycemia, is it clear? Hypoglycemia, is it clear? So for hypoglycemia, you use to diagnose hypoglycemia, you just speak about the Whipple's triad. Is it clear? You just speak about the Whipple's triad in order to diagnose hypoglycemia. Now, to diagnose the hyperglycemic crisis, we need to know diabetic ketoacidosis. Is it clear? You now need to know diabetic ketoacidosis. Is it clear? Now, for diabetic ketoacidosis, you need to know also HONC. Generally, the patient that has diabetic ketoacidosis, you have already said all the elements on physical examination and the presentation the patient is going to have. But now, to prove diabetic ketoacidosis, we first have hyperglycemia. Since it's made up of hyperglycemia as first element in diabetic ketoacidosis, usually the random blood sugar in diabetic ketoacidosis is between 250 to 600 milligram per deciliter. So if you have a patient that has a blood sugar level between 250 to 600 milligram per deciliter, you think of diabetic ketoacidosis. That's the first element. The second element is ketosis. Is it clear? So you now ask for a urine dipstick. Is it clear? Ask for the urine dipstick, and urine dipstick, you're going to visualize what? You're going to visualize ketone bodies. Is it clear? In urine dipstick, you're going to visualize ketone bodies. When you visualize ketone bodies, that is when you have when you visualize ketone body, that's when you think of ketosis. You confirm that it's actually ketosis in the body. Now the third element is acidosis. Is it clear? To confirm acidosis, you now ask for arterial blood gases. Is it clear? So arterial blood gases, and at the level of arterial blood gases, you're going to see the pH metric, or the pH scale. Is it clear? So you ask for arterial blood gases to see the pH metric or the pH scale. So those are the three elements that you come out now for the diagnosis now of diabetic ketoacidosis. Now to come out with the diagnosis of HONC, the first element is hyperglycemia. Is it clear? Now, but the hyperglycemia in HONC now is going to be very high. So here you have a random blood sugar of greater than 600 milligram per deciliter. If you have a random blood sugar of greater than 600, you think more of HONC. The second element is hyperosmolarity. Is it clear? Hyperosmolarity. Generally, you need to know that what you calculate if you calculate the osmolarity of blood and it's greater than 320 milliequivalent, is greater than 320 milliequivalent per liter, it means that the patient has HONC. Hyperosmolarity. Now, how do we calculate the osmolarity of blood? Osmolarity is calculated as 2 times the concentration of sodium ion, 2 times concentration of sodium ion plus concentration of glucose all over 18 plus concentration of urea all over 2.8. So that's how you calculate the osmolarity of blood. So 2 times sodium ion concentration plus glucose concentration divided by 18 plus urea concentration divided by 2.8. You calculate for the osmolarity, and this one should be milligram per deciliter. Is it clear? This one should be milligram per deciliter, and this one also should be milligram per deciliter, but this one should be milli equivalent per liter. Is it clear? To divide by 18, you divide by 18 in order to convert the milligram per deciliter into in order to convert it into milli equivalent per liter, and you divide by 2.8 in order to convert the milligram per deciliter into milli equivalent per liter, so you can add all the units together and produce the answer in milli equivalent per liter, 320. But if it is less than 320, it's more going towards the diabetic ketoacidosis. So that's how you you investigate for your disease. Is it clear? Now, the next thing to investigate is to investigate now for the cause. Is it clear? You want to investigate now for the cause. Yeah, the cause of the hyperglycemic crisis is actually the precipitating factor. Is it clear? Now, we have already said the precipitating factor can be involved in the 4 different elements, the different systems that we have said. We have the respiratory system, we have the urinary system, we have the integumentary system, and we have the gastrointestinal system. So those are the 4 elements, 4 systems in order. Is it clear? So you start with the respiratory system. So in the respiratory system, you ask for a chest X-ray. Is it clear? To support chest X-ray, to support that there is actually a consolidation. Is it after your physical examination, you do a chest X-ray to support if there is any consolidation, any lesion, and then you do a sputum analysis if the patient is coughing. Is it a sputum microscopy if the patient is coughing, to visualize for white blood cells inside. Now, for urinalysis, you start with the urinalysis. Just do urinalysis where you're going to see leukocyturia, and the urine microscopy you may see even bacteria. Now, the integumentary system, you do a skin swab. Is it clear? Do skin swab and microscopy. Is it clear? Skin swab